Hello and welcome back to Business Matters of the Hindu with me, K. Bharat Kumar. You do not know what it means to be lonely till you spent time being alone, wishing companionship. This is what Mr. Ratan Tata said when he unveiled a startup that he had funded called Goodfellows. Goodfellows offers young graduates trained to offer companionship to senior citizens. Think of it like a grown grandchild being on call. Intriguing, right? From a nation that was about 8 decades ago comfortable with the idea of 10 to 15 children per couple, and how we've evolved into a society that demands companionship and is ready to pay a fee for it. Let's see how our burgeoning population and the aging part of our population specifically has helped this industry evolve. About 2 or 3 decades ago, you could not have found too many for-profit organizations targeting services specifically at senior citizens. At that time, back in 2000, the industry wanted to solve small problems, like the NRIs being away and their aged parents back in India wanted assistance in terms of just errands that needed to be run. Probably have your passbook printed at a local bank branch, or accompany the parent when he or she went for an X-ray or an MRI scan. I remember this company just as an example, Your Man in India back in 2000. It positioned itself as a concierge service. It has since been acquired by the TTK group. Back then, if you wanted assistance in terms of manpower in taking care of a sick and an elderly person, you didn't have formal agencies or companies that you could call into and say, hey, I need some services. You probably heard by word of mouth, somebody has done a good job with a relative, and you sought out that person saying, can you come and assist me? And he or she did a good job based on common sense and experience. After this, small-time manpower services mushroomed all over the country. If I had a network of 10 or 20 people, then I list myself on an online something like the Craigslist equivalent in India, and say, this is what I have on offer, male or female helpers on demand. Later on, entered organized companies into the space. Hospitals are an example. If I ran a hospital, I saw a patient in the ICU get better, go onto the general ward, and then go back home. But it's highly possible that this patient's children were away in the US or somewhere in the West, and the spouse of the patient was not fit enough or strong enough to give 24/7 care. So they needed helpers. So I saw an allied opportunity. It's an allied business to the hospital business. And say, you know what, let me get into this. I can do a great job. Dr. Mehta's hospitals in Chennai is an example. Likewise, Manipal hospitals that started off in Karnataka, Apollo, and so on are great examples here. At around the same time, standalone companies in the healthcare space, Porsche being an example that was started by entrepreneur couple Meena Ganesh and K. Ganesh, started offering a wide gamut of healthcare services on demand, including trained manpower. And when I say trained manpower, both in the case of these hospitals offering allied services and standalone companies, you could get nurses that were trained to give you ICU level services. They could give you intravenous drips. And then you have startups that sense different opportunities in the space, Goodfellows being an example. Right? And here we are only talking about services and not products like equipment to assist the elderly, like walking sticks, wheelchairs, or for that matter, pharmacy expenses monthly, adult diapers, none of this, it's just services. This is the industry that we're talking about right now. Why is there such corporate interest? Obviously because there's a burgeoning, aging population in India that needs these services and is hopefully willing to pay for them. Estimates of industry size are being bandied about. You get a wide range depending on what categories come in or out. About $1.5 billion to $5 billion is what the estimates tell us. But let's take a look at the size of the population as such. As per the longitudinal aging study of India conducted by the Indian government, and which report came out in 2021, 319 million people will be at or above the age of 60 by 2050. That's more than a threefold increase as per the data that we got in Census 2011, which is about 103 million. The report also says that 75% of these senior citizens would have some chronic disease or the other, 40% would be suffering from some disability, and 20% will have mental health issues. This is a very sobering note for us. A 2017 report by the United Nations titled World Population Aging shows that India's population age 60 or above would account for 20% of its total population by the year 2050. In other words, by that year, 1 in 5 people that you know will be a senior citizen. You think 2050 is really far out, 28 years from now, doesn't matter? Hold your breath. An article published by the Hindu's data team recently showed that this milestone would be reached much faster in southern states like Tamil Nadu and Kerala, that is by 2036, where 1 in 5 people that you know will be a senior citizen. Of course, if you compare India with other countries, their demographics are changing much faster than India's. But if you compare India's own numbers now versus 2-3 decades ago, we are a far quicker aging population. A report in 2021 by the Ministry of Statistics and Program Implementation, MOSPI for short, showed us that general population grew 12.4% between 2011 and 2021, and about 18% in the previous decade. But the aging population, or senior citizens, that is age 60 and above, grew 36% in each of these 2 decades. Significant difference. So far, we've been looking at numbers comprising a certain population, how corporates may find it attractive, and so on. But from an individual's perspective, affordability seems to range across an entire spectrum. The MOSPI report that we just referred to warns us that an aging population has several societal and policy implications. It warns us that the shifting demographics threatens to lower labor participation rates and savings rates, threatens to increase health expenditures and put a strain on health schemes of the government. So what are the concerns surrounding the rising number of elderly people in our population? An October 2021 report by the Niti Aayog titled The Missing Middle talks about 30% of our population, of 40 crore individuals, who are devoid of any financial protection for health. This particular section, the missing middle, is not eligible under government subsidized health insurance schemes, nor have they voluntarily signed up for private health insurance like the well-to-do have. World Bank data shows us that as of 2019, India's government spending on health expenditure is about 3% of GDP, among the lowest in the world. Compare this with a global average of about 9.8%. When a country has been traditionally spending such low amounts on public health infrastructure, what happens is such systems become overburdened over a period of time. As a result, individuals seeking treatment do not have an option but to look to the private sector. As of 2018, 60% of all hospitalizations and 70% of all outpatient treatment was given by the private sector. Because of lack of adequate insurance cover across the population, 63% of health expenditure came from out of pocket, which means I spent from my pocket for my health expenditures. I'm not covered by private insurance or the government or my employer. Compare this with the global average, which is reportedly at 18%. To end this episode on a somber note, the Niti Aayog in its report tells us that the high out-of-pocket expenditure makes India's populations vulnerable to what it calls catastrophic spending and impoverishment from expensive trips to the hospital. Till the next episode of Business Matters, it's goodbye from us. Have a lovely week ahead.